12 warning signs of breast cancer. Studies have shown that there were 2.3 million women diagnosed with breast cancer in 2022. Breast cancer is the second most frequently diagnosed cancer worldwide and holds the top spot as the most common cancer in women. We all know someone who has been affected by breast cancer. And breast cancer awareness is not just about knowing the signs, it's about acting when those signs appear. Today, we will talk about the key warning signs of breast cancer and provide some practical tips for staying proactive about your breast health. Let's get right into it. Quick reminder, we are not doctors. This video is for information purposes only. If you are experiencing a medical condition, don't hesitate to speak with your doctor. Number 1, nipple discharge. Spontaneous discharge, meaning a discharge that occurs without squeezing the nipple, is very concerning. This refers to any fluid that comes out of your nipple when you're not pregnant or breastfeeding. While it's true that certain benign conditions like infections or hormonal imbalances can cause nipple discharge, it can also be a sign of breast cancer, especially if the discharge appears from only one breast. In breast cancer, discharge may be caused by a tumor growing inside the milk ducts, which disrupts normal breast function. The color of the discharge may vary. It could be clear, yellow, greenish, or bloody. So if you notice any unusual nipple discharge, don't hesitate to pick up the phone and make that appointment. Number 2, unexpected change in size or shape of your breast. Breast asymmetry is normal. Our breasts constantly change throughout our lives due to hormonal fluctuations from our menstrual cycles, pregnancy, and even menopause. So it's perfectly normal for your breasts to feel a little different at different times of the month. However, if you notice any sudden or dramatic changes in the size or shape of one or both breasts, it could indicate an underlying issue. This might also be accompanied by tenderness or a feeling of heaviness in the affected breast. Swelling of all or part of a breast, even if there's no lump felt, can also signal a potential problem, especially if it's persistent and doesn't fluctuate with your menstrual cycle. This can occur when cancer causes swelling, distorts breast tissue, or pulls on the surrounding skin. For example, if one breast becomes noticeably larger or smaller than the other, that's something you'll want to get checked out. Number 3, lump in the breast or armpit. Perhaps the most well-known sign of breast cancer is finding a lump in your breast tissue itself, or in lymph nodes located in your underarm, or even near your collarbone. Lumps that are painless, hard, and have irregular edges are more likely to be cancerous, but some lumps may be tender or soft. These lumps form when abnormal cells in the breast start to multiply uncontrollably. These cells don't function like normal breast cells, and instead of following the usual growth and division cycle, they grow at an accelerated rate. Over time, this excessive growth leads to the formation of a mass or lump. These lumps may be easier to feel than to see, so regular breast self-exams can help you become familiar with your breast tissue and detect lumps early. Know your body to catch anything unusual early. Make an appointment right away if something doesn't feel right. Before we move on, can we ask for a quick favor? If you're finding value in this video or any of our other videos, please help us get this channel to 1,000 subscribers by clicking that subscribe button as well as the like button. Your support means the world to us, and it helps us spread the word and keep bringing you content you'll love. Thank you. Moving on. Number 4, nipple retraction or inversion. Nipples come in all shapes and sizes, and that's perfectly normal. Now, some people naturally have inverted nipples, and that's totally fine. But if you notice a change from your normal, like for example, your nipple suddenly starts to invert or pull in when it wasn't like that before, that's when you need to pay attention. Your nipple pulling inward instead of sticking out can be subtle or more pronounced. This happens when a tumor behind the nipple causes the skin and tissue to pull inward, leading to this change. Nipple retraction doesn't necessarily mean cancer. Infections or non-cancerous conditions could also cause it, but sudden or unexplained retraction always requires medical attention. Number 5, ulcers or sores on the breast. Sores on the breast are particularly concerning when they don't respond to topical treatments or seem to get worse over time. Ulcers or sores that develop on the breast and don't heal are more often seen in advanced stages of breast cancer. These open wounds or lesions can be painful or ooze fluid. In advanced stages of breast cancer, the tumor may grow toward the surface of the skin. As the cancerous cells spread, they can break through the layers of skin, disrupting normal skin function and structure and creating an ulcer-like sore. In addition, as the tumor grows, it demands more nutrients and blood supply. Sometimes, the tumor outgrows its blood supply, causing areas of the tumor and nearby skin to die off. This is known as necrosis. This tissue death leads to the formation of open wounds, or ulcers. If you notice anything that looks like a persistent wound or ulcer, it's essential to have it checked. Number 6. Persistent breast or chest pain. Breast cancer is typically not painful in its early stages, but some forms of cancer can cause pain or discomfort. Pain could be localized to one spot or radiate across the breast or chest area. Here's how it happens. As a cancerous tumor grows, it can press on nearby nerves, blood vessels, or muscles, which can cause pain. The larger the tumor, the more likely it is to irritate these tissues, leading to a sensation of pressure or soreness. This pain may feel sharp, stabbing, or constant and dull, and may not go away with time. Breast or chest pain can occur due to various changes happening within the breast tissue, such as cysts, infections, or hormonal changes. Now, I'm not saying every little ache and pain means you have breast cancer. However, if the pain is not related to any specific injury or activity, doesn't go away, or is paired with other symptoms, such as lumps or changes in the breast, it's best to see a doctor. Trust your instincts and seek medical advice if something doesn't feel right. Number 7. Redness, warmth, or flaky skin in the nipple area. Redness, warmth, and flaky skin are symptoms often associated with inflammatory breast cancer, otherwise called IBC. This is a rare but aggressive form of breast cancer. This type of cancer blocks the lymph vessels in the skin of the breast, causing the skin to become red and swollen. The breast may feel warm to the touch, and you may notice the skin becoming thickened. In addition, skin changes around the nipple, like flaking or crusting, can signal Paget's disease of the breast, another rare form of cancer. It usually affects the nipple and the areola, leading to scaly or flaky skin that may feel tender. So, you see, it's really important to pay attention to those subtle changes in your breasts. Always be vigilant and see your doctor if you notice anything unusual. And up next, number 8. Unexplained fatigue and weakness. Cancer-related fatigue hits different from everyday tiredness. It's a deep, unrelenting exhaustion that doesn't improve with rest. Breast cancer can cause this type of fatigue by using up your body's resources to fight the disease. The fatigue may be a direct result of cancer, or it could stem from other factors, such as anemia, which is low red blood cells and is common in many cancer patients. If you notice persistent fatigue along with other symptoms, it could be a sign that something is wrong. It's important to listen to your body and pay attention to any significant changes in your energy levels. If you're used to being able to power through your day and all of a sudden you're struggling to get out of bed, that's a wake-up call. Therefore, if you're experiencing persistent, unexplained fatigue, don't brush it off. Number 9. Irritation or dimpling of breast skin. Have you ever noticed how an orange peel looks? It has those little dimples all over it, right? Well, sometimes the breast skin can develop a similar appearance, and that's what we mean by dimpling of the breast. Dimpling of the breast skin can occur when breast cancer causes the lymphatic system to become blocked. It results in fluid buildup that causes the skin to dimple or pucker. The texture might resemble the surface of an orange, with small indentations or uneven areas. Breast dimpling is often associated with inflammatory breast cancer and is a sign that requires immediate medical attention. Moving on to number 10, change in breast color. Some variation in breast color is totally normal, but there are certain color changes that should raise a red flag. Literally. A change in the color of the breast can indicate various conditions, including breast cancer. Redness is one of the most common color changes associated with breast cancer, particularly inflammatory breast cancer. As cancerous tumors grow, they can interfere with blood flow to the breast. Reduced blood circulation can lead to patches of discoloration, making the skin appear darker or bruised. This form of cancer blocks the lymph vessels in the skin, leading to fluid buildup and inflammation. As a result, these areas may look reddish, purplish, or bluish, depending on the severity of the disruption. They may even appear bruised without any external injury. Remember, anytime you notice a change in the color of your breast that persist or worsen, it's important to see your doctor as soon as possible. It should never be ignored. Number 11. Sudden weight loss. Experiencing weight loss? That's a good thing, right? We all fluctuate a bit and sometimes life gets in the way. If you notice that you're losing weight without changing your diet or exercise habits, it could be a sign that your body is struggling to cope with the disease. Here's the thing. Cancer affects metabolism, leading to weight loss as your body uses more energy to fight the illness. Weight loss may also be accompanied by changes in appetite or muscle mass. This unexplained weight loss usually appears in more advanced stages. It's essential to pay attention to your body, especially if you experience significant weight loss paired with other symptoms. Last but certainly not least, number 12. Irritated, itchy breasts. We've all experienced an itch here and there. Maybe it's dry skin, a new detergent, or just one of those things. But when it comes to our breasts, persistent itching or irritation is something we need to be mindful of. Persistent itching in the breast area can sometimes also be a sign of inflammatory breast cancer. This rare, aggressive type of cancer can cause the skin to become itchy and irritated due to the buildup of cancer cells blocking the lymph vessels. So how can you tell if your itchy breasts are something to be concerned about? While itchy breasts can also be caused by allergies, eczema, or other non-cancerous skin conditions. When itching is paired with redness, swelling, or other breast changes, it's crucial to seek medical advice. Now, here are some practical tips for staying proactive about your breast health. Tip number 1, regular self-exams. Performing regular self-exams is one of the easiest ways to keep track of any changes in your breasts. This involves feeling for lumps or changes in texture and looking for any visual differences, like changes in size, color, or skin texture. Aim to do this monthly, and the best time is a few days after your period ends when your breasts are less swollen. If you're no longer having periods, choose a random day of the month, like the 15th, to keep things regular. You could even set a monthly reminder on your phone. Tip number 2, clinical screenings. In addition to self-exams, regular clinical screenings such as mammograms or breast exams conducted by healthcare professionals are vital, especially if you're over 40 or have risk factors like family history. These screenings can detect abnormalities long before you notice any physical symptoms. Tip number 3, know your family history. If you have close relatives who've had breast cancer, your risk may be higher. Speak to your doctor about genetic counseling or testing for mutations in certain genes which increase the likelihood of breast cancer. Knowing your family history helps you take preventive steps early. Tip number 4, healthy lifestyle choices. Eating a diet rich in fruits, vegetables, and whole grains, exercising regularly, and maintaining a healthy weight can all reduce your risk of breast cancer. Limiting alcohol and avoiding smoking also lowers your chances of developing the disease. By paying attention to changes in your body and taking preventive measures, you can catch breast cancer early and improve your chances of recovery. If something doesn't feel right, always trust your instincts and get it checked out. It can literally save lives, so it's crucial to be aware of the signs. By being informed and proactive about your breast health, you're taking an important step in protecting yourself. Thanks for watching. We hope this video has been informative. If you found it helpful, hit the like button. Please remember to comment, share, and subscribe for more. Until next time, take care of yourself and each other.